Hello everyone, welcome and thank you for joining me. This video has been created to highlight for you an interdisciplinary advocacy opportunity important to improving the quality of service delivery for speech-language pathologists, audiologists, occupational therapists, physical therapists, and respiratory therapists. The Allied Health Workforce Diversity Act was introduced in May of 2021 by U.S. Representative for Illinois, Bobby Rush. This bill will allow the Department of Health and Human Services to provide grants, including scholarships, as well as recruitment and retention efforts to accredited education programs to help increase diversity across allied discipline programs. Why is this bill so important? The reason that this bill is so important is that currently in the U.S., there is not a diverse representation of minority healthcare workers in the allied healthcare fields. The U.S. has about 28% of its population that identifies as racial minority, yet in the allied healthcare workforce, there are far less professionals representing those minorities. As seen by these charts from the demographics by race of various allied disciplines mentioned, minority groups represent much less than the overall U.S. population. The diversification of minorities in the workforce is much slower than the increase of diversity we see in the population in general. For example, in the profession of speech-language pathology, 3.3% of the workforce identifies Asian, 4.2% identifies Black or African American, and 8.2% identifies Hispanic or Latino. This compared to our white colleagues that represent over 80% of the workforce. Further, studies have shown that racial and minority groups disproportionately live in areas with provider shortages, and members of racial and ethnic minority groups are more likely to practice in those shortage areas. Also, studies have shown that patients who receive care from members of their own racial and ethnic backgrounds tend to have better outcomes for their health. So what can be done for the future of allied healthcare in terms of diversifying the workforce and addressing these discrepancies? By providing opportunities through scholarships and grants, diverse and minority groups will have access to studying further and obtaining their graduate degrees in allied healthcare fields, thereby promoting a more diverse pool of professionals in the workforce. Grants and scholarships can allow students to access these programs, thereby increasing the number of trained professionals in the field. By having more providers in the allied healthcare field, we will be able to access more patients and clients that need the services, thereby improving healthcare outcomes. This bill is so important to me as a minority healthcare provider. I've worked in Connecticut public schools as a speech-language pathologist for about 20 years. And in that time, I have not seen a huge change in the recruitment, retention, and training of minority healthcare professionals. I've worked in school districts with a large minority population, close to 40%, and have been the only SLP of color. So today, I call upon you, my fellow healthcare providers, across all allied disciplines to contact both your state and U.S. senators and representatives, sharing with them your support for the Allied Healthcare Diversity Act of 2021. Click on the hyperlinks that you see in the slide to take you to a sample of a letter or a tweet that you can send out, as I will be doing to my representatives. For further information on diversity and equity efforts within allied disciplines, please visit these websites and see what else is being done to improve equity and diversity in your field. Thank you for listening.